This is my subcutaneous heparin video demonstration. First, it's important to know the 6 rights of safe medication administration, which are right patient, right time, right route, right dose, right medication, and right documentation. And it's important to remember hand hygiene. So I'm going to wash my hands before I begin. I'm going to check the MAR. It says the patient is to receive 5,000 units of heparin subcutaneous every 12 hours for 3 days. My heparin ampule contains 10,000 units per milliliter, so I'm going to give 0.5 milliliters of the heparin. So I've washed my hands. I'm going to take my ampule, remove it from the bubble wrap, and then I can kind of flick the top to get all of the medication out of the cap. I can set it upright, and then I can use a 2x2 gauze pad to break it open. So I'm going to hold it away from my body and just snap the top off, making sure not to break glass on me. So I got my heparin ampule, which I'm going to set down. And I'm going to remove my needle from the packaging, my 27 gauge needle, and remove it from the case. And then I'm going to attach a filter straw onto the top. So I will carefully remove the needle top, place it on a clean surface, and put the filter straw on. In the tip of the filter straw, there's 0.2 milliliters of air in there. So I'm going to put my ampule just on the table, insert the straw, careful not to touch any of the edges, and then I'm going to draw up 0.5 milliliters. So I'm just going to draw this up to 0.7 because I know that it has 0.2 of air in there. So I got my 0.7, remove that. I can discard safely of my glass ampule. And then I can take the filter straw off, dispose of the filter straw. And then I'm going to place my needle back on and check, and I have my 0.7, so that's got my 0.2 of air also. And then the 0.5 of the heparin. So then I'm going to go into my patient's room. Hi, my name's Maddie. I'm going to be your nurse today. I'm here to give you your heparin injection. And then I'm going to ask for them to state their name and date of birth and check the patient's wristband so that I have 2 identification checks. So I will go over to the patient and clean the area that I'm going to be injecting, which will be in the stomach, going in a circular motion from the inside out. Dispose of my alcohol swab, wash my hands, put on my gloves. Really, I probably should have put on my gloves before I clean the patient's skin. Okay, so I got my gloves on. Patient's skin is clean. I can take my needle and I'm going to just check again. So I got the 0.7, which is 0.5 of my heparin plus the 0.2 milliliters of air that was in the filter straw. Remove the cap. I always place it on a clean surface just in case I have to. Well, I guess it doesn't matter in this instance because I'm just going to dispose of it. And then you're going to pinch up the skin and at a 45-degree angle on non-obese patients and a 90-degree angle on an obese patient, but I'm going to go at a 45. Swift in and very slow push. making sure to leave it for a few seconds after to make sure that all of the medication escapes the tip of the needle. And then I would recap, because I'm going to walk across the room to dispose of this in a sharps bin. Dispose of that with heparin. For this injection, you don't want to check for blood return at all. It's just in and out. I could blot away any blood left behind, but careful not to massage or push too hard on the site, because that will cause bruising. Wash my hands, and then I'm going to make sure the patient is comfortable, ask if they need anything, call light is in reach, and then I'm going to go and document the site that I did the heparin injection and the dose and the time.